Welcome to Texas 2036's virtual series, Straight Talk Texas, where you have a front row seat to conversations on topics important to our future. My name is Enisha Shropshire, Director of Board and External Affairs here at Texas 2036. Today, our founder and chairman, Tom Luce, is joined by Kristi Sherrill Hoyl, the Chief Policy and Community Officer at Baylor Scott White Health, the largest nonprofit healthcare system in the state of Texas. Tom?
Well, it's a real pleasure to visit with Kristi Sherrill Hoyl. I knew her when she was Kristi Sherrill. We've known each other a long time, and used to be the chief of staff to Mayor Ron Kirk in Dallas, and who, by the way, is also on the Texas 2036 board. So I've known Kristi a long time, and now she's in a key slot at Baylor Scott White. And as Anisha said, Baylor Scott White is the largest healthcare system in the state, and their spread is throughout not only the North Texas area, but also Central Texas. Kristi, you might describe for our viewers kind of the breadth and depth of the Baylor healthcare system.
Sure. Thank you, Tom. Thank you for having me today. This is a great opportunity for us to talk about some of the issues going in healthcare. Baylor Scott White Health has 52 hospitals across our system. And what makes us unique is that we not only have large tertiary centers like the one at Baylor University Medical Center in downtown Dallas, we also have rural health in Llano and Brenham, and we go all the way to Austin, Texas. So we take care of Central Texas and Austin and the Austin Round Rock region. So we take care of 1 in 10 Texans right now across the state. So we are big players in providing health care for the state of Texas.
And Kristi, that, raises issue. Not, of course, everybody is focused on COVID right now. And I want to first talk about COVID, but then I want to get to the rest of the healthcare issues that Texas face. But let's first talk about COVID. As an outsider and a citizen observing things, it looks to me as if the hospital system per se in the state has so far been able to handle the enormous increase in COVID cases and the impact on the health system. Is that a fair summary? Now, I know that today doesn't mean tomorrow.
That's right. That's right. I think that is a very fair assessment as to where we are right now. Our initial modeling was that if we hadn't done these very strict rules around staying at home and social distancing, the wave of COVID patients would have overtaken the healthcare system in the state of Texas. So even though I know people have felt a lot of pain with staying home, it was absolutely the right thing to do for Texas. And going forward, it's really critical that we maintain that personal responsibility, wearing your mask, wearing gloves, staying home if you can. I think we've all learned that we can function and do really well staying at home through technology, but also making sure that we recognize that it is our responsibility to take care of ourselves and our families in our community that we live in. But I will have to say, from my perspective, the Baylor Scott White team has done an extraordinary job. And I would say the healthcare providers across the state have done a really great job in being prepared and understanding how to take care of these COVID patients to the best of our ability. And as a result, I think our outcomes were much better than we initially modeled. But the frontline staff in our organization and across the state have just been superb.
And fortunately for us, and unfortunately for New York, we were able to observe what happened in New York and prevent that from happening in terms of our healthcare system crashing, it seems to me.
Oh, absolutely. I mean, I think once those numbers started ramping up so quickly and looking at what happened in New York, I think the state of Texas did a very nice job in recognizing, and local and county leaders did a very nice job recognizing we got to take this very seriously, and let's start educating our communities and putting these pretty serious regulations in place to make sure people stay at home.
And now, Kristi, as we are beginning to restart and get and move what I'd call to a new normal, it's we're not going back to normal for a while. So as we talk about the new normal, one of the things that was an unfortunate side effect that we all had to live with is that we were also postponing a lot of other healthcare needs, non-COVID related, such as mammograms or getting your heart checked up or checking a place on your face for skin cancer. I mean, and so I've worried a lot about what I'd call the buried healthcare needs as we responded to the necessary tyranny of the urgent. And how is Baylor Scott White feeling about that and how we deal with gradually reopening that?
So one of the things we were able to do very quickly was we'd already had an app for a lot of that primary care service, and we pivoted very quickly and could continue to care for patients at home. 80% of our clinic visits now are done by app, which is extraordinary. That pivot was hard and fast. We're also now in the process of opening up our facilities, to patients that are ready to come in. And that's, making sure we have masks for everyone and that we have the hand sanitizer stations for everyone and to limit the number of people that are coming in and out of the facilities. But you're absolutely right. There are some healthcare needs that require an in-person visit. I think a mammogram is a perfect example of those sorts of issues that have to be addressed, and they need to be addressed in a timely fashion, or you have other issues down the road. So we are preparing our team to start accepting patients in the safest and healthiest way, not only for our caregivers, but also for those patients as well.
Well, and as we're talking about that, of course, it's not only access to healthcare, it's affordability, the ability to really afford to go. And of course, we're all just devastated by the economic news. I saw one, Text 2036, we're data focused, and in 3 weeks in March, we had more unemployment claims filed in Texas than we did the entire year of 2019.
Yeah.
And that's going to be a huge issue in our state, is the vast, we already had a vast population that was uninsured, and now it's going to dramatically increase. I mean, people aren't going to be able to afford COBRA payments, even though they may have the legal right, or they didn't have full coverage. And this whole issue of the cost of healthcare is going to be front and center, it seems to me, for the next year or two, or we're going to have serious fallout in what I'd call and we're learning the importance of a public health system. We're learning the health of you matters to me. And we've learned that graphically. And I just wonder what the thoughts are about Baylor Scott White about those issues.
Well, one of our core tenets is safe, affordable healthcare and everything that we can do to drive out cost within our own system. But we also recognize, how do we make it accessible for those with insurance and without insurance? But Tom, I think to your point, there was a Gallup poll, I think 2 days ago, that said even those with COVID, there's a significant number of people that don't want to go and access care because they're concerned about the cost and how they're going to pay for it. And I think that same issue is going to affect more and more Texans that don't have access to insurance. And, how am I going to pay for this? And is this more important than, paying for my rent or my housing cost or food? And so that is going to be an issue that we're going to have to address I think in the short term versus long term, I mean, if you think about the state of Texas, we had the highest uninsured rate going into COVID, and it's going to be interesting, with 2036, looking at the data, what are those numbers now? I mean, how fast has that uninsured population grown over the last 6 weeks? I suspect it's going to be exponential. And I think people are also scared about their jobs. What happens, by the summertime? Am I still going to have a job? And will I still have a job that has insurance attached to it? So I think there are a lot of scared people out there, frankly. And I understand that, but we do recognize that people have got to have access to care, and that preventative care is critical. So it's better to have the short cost up front than the more expensive cost of having to have a stent or having to have some of these other things that occur because you didn't take care of, that primary care visit.
Well, and that's really in the long term, that's how we deal with healthcare cost, is moving things from what I call treatment in stage 4 to treatment in stage 1.
Absolutely.
I mean, that's really the way you have to control cost. And let me ask you this, and I know you all made a hard and fast move on for lack of a better word, let's call it telemedicine.
Yeah.
And my own physician, I went that route.
Mm-hmm.
To what extent do you think that will sustain itself post-COVID? You hear various debates about that, and I understand some reluctance of that. But on the other hand, it certainly has worked for me in certain aspects, and I'm just wondering how you all are thinking about it. What's been the reaction of the doctors, the patients?
Well, so when I say 80% of our visits are now telemedicine, our doctors jumped on and recognized how important it was to provide this service and how to stay connected to their patients. And so I think there is probably no going back. I think we can get better at it, but I don't think we're going to go back. It's, if you can get the same care from your home or your office, why would you go in and sit in a waiting room that you're not sure who's been here before? I mean, it makes sense, right? And so I think the way we interact with each other in a healthcare space is changed forever. And we're planning for that. We recognize this is an easier way for folks to get their care. And I actually had more time when I had I also am a user of telemedicine, and had much more time with my physician. It was great.
Well, I have a doctor who sent me a picture of his haircut, and his is grown as long as my has. So
I'm starting to look like I did in high school.
Yeah. We've all had certain adjustments to deal with.
Exactly.
And let's talk a little bit more about this issue of the rural healthcare, because as you all said, as we said in the beginning, I'm very concerned about the capacity in rural parts of the state. I mean, we may look at it and say, well, they've got less cases than they do in Dallas, or less cases than they do in Fort Worth, but that doesn't mean that Llano doesn't face the same risk of a healthcare system crashing. How are you seeing it play out, the COVID, in the non-metropolitan areas?
It's a very good question. So, prior to COVID-19, Texas lost the most rural health hospitals in the country. Tennessee was second. Texas was first. So,
go Texas! We're number one, right? I mean, golly.
So, the margins for rural healthcare are so slim, and then you put this pandemic on top of them, and the stressors are enormous in rural healthcare, and and I think it also shows kind of the real challenges. How do we take care of our rural communities across the state of Texas? And I think telehealth is going to be an option, but you've got areas that don't have reception. I mean, they don't have the fiber optics necessary to have a robust telehealth opportunity. And I think
Can I interrupt right there? And let me say, one of the big issues for Texas 2036 is broadband access throughout the state. And it seems to me it's critical.
It is critical. I mean, we actually were trying to create an application for several rural providers that aren't in our system, but are in the Texas community, and they did not have the broadband necessary to even apply for these grants. So there are these grants available, but if you don't have broadband, you can't access those dollars. So I think we're going to have to come to terms with the needs of those communities. I think we're also going to have to really think about how we deliver care and how we're going to support that care, because we have a lot of rural health communities that you have to drive a long way to have a baby, or if you have a heart attack, or if you have a car accident. And so there is a real need for rural health in a state like Texas, and we're going to have to support it financially.
Well, and as we begin to wrap up, it seems to me that I hope that all of Texas, and I know you and I share this view, Kristi, can understand that COVID really revealed strengths and weaknesses in our healthcare system.
Yes.
That were there. And the question is now, what are we going to do about that to prevent the next health crisis? It may not be COVID. I mean, it may be COVID again in the fall. Mm-hmm. It may be a new pandemic, or it may be more and more of our population being obese or having diabetic conditions.
That's right.
But it has revealed the strengths and weaknesses of our system, the lack of access, the lack of affordability. And I hope that we'll use this opportunity in this situation to say to ourselves, we've got to address these issues. Mm-hmm. And we can't just put a Band-Aid on the system. We've really got to start rehabilitating the patient. And in this case, the patient is the healthcare system of Texas.
I would add one more caveat, and it's some of the work that you all, and you in particular, are leading on is the need for good data. I mean, and the reporting systems. One of the things we found during this crisis is that our reporting systems are antiquated, and we're sending the same information to 3 levels of government. And so the work that you are doing with 2036 is critical to help us develop those pathways to understand how to be prepared and what we're dealing with. And so, you're building the ship while you're floating, but I will tell you 2036 is going to be a big part of the answer going forward.
Well, I appreciate that, and we're really finding this. We're trying to build a dashboard right now to inform Texans about COVID, and the lack of uniformity of reporting data across the state is a problem. I mean, we have state policymakers that sincerely want to rely upon data, but they don't have an instrument panel right now in which to fly the airplane. And,
the airplane's more.
Yeah, and I want to get on an airplane that has an instrument panel. I mean, I know they didn't do that 50 years ago, but this is, 2020, and we need an instrument panel. So, Kristi, I really want to thank you for spending some time with us on this whole situation. I want to personally add my thanks to Baylor Scott White and our other healthcare providers. I mean, my goodness, the work people have done at Parkland and Texas Health Resources, and I mean, all over our county health departments. I mean, everybody has just been working night and day for weeks, and it's really amazing to watch. And some of these first responders rushing in those emergency rooms just makes you want to cry. I mean, it's just amazing the work they're doing. So please express our gratitude to everybody at Baylor Scott and White, and thank you very much for being with us.
Thank you so much, Tom. Really appreciate what you're doing.
Take care. Bye-bye.
Bye-bye.
thank you all for watching Straight Talk Texas. If you have questions and feedback, we want to hear from you. Email us at straighttalk@texas2036.org and follow us on social media and sign up to receive our emails. Visit texas2036.org for more information. Until next time, wishing you and your family well.